مرحبا بكم مشاهدينا في
Our press conference for Lieutenant General Commander-in-Chief of Dubai Police Abdullah Khalifa المري and His Excellency Director of Dubai Health Authority Hamid Muhammad al-Qutami. With our video conferencing, we have with us a number of media people and editors-in-chief in the media institutions in the UAE. Good evening, Lieutenant General. We would like to thank Dubai Police for all its efforts to make Dubai safe and assured. Dubai Police is working round the clock to guarantee the adherence to the national sterilization program. Lieutenant General, can you give us a general idea about what is happening in the Dubai? What are the special efforts taken and what are the measures taken to contain the spread of COVID-19? Good evening. Of course, we would like to thank you all. We thank all the media institutions in the UAE, especially in Dubai, for all the efforts that they have deployed and that are shedding the light on what the local and federal authorities are taking of measures. As you know, in Dubai, all authorities, all stakeholders, all the government entities are working as one team under the guidance of His Highness Sheikh Mohammed bin Rashid Al Maktoum and His Highness Sheikh Hamdan bin Mohammed. Of course, all the government authorities, all the government institutions are taking the steps taken. Your Excellency Hamid Muhammad al-Qutami, of course, all the UAE community, the Dubai community would like to thank you for all your efforts. We highly respect you. You are today the first front line in fighting this pandemic that hit the world. We know that today the total number of patients globally is 1.5 million and the death toll reached 90,000 globally, not to forget also the recoveries that exceeded 330,000 globally. First of all, what are your priorities today at the Dubai Health Authority in order to contain the spread of this pandemic? In the name of God Almighty, we would like, of course, to extend our thanks to all the media institutions today who are covering this press conference. Undoubtedly, the UAE, with the leadership and the guidance of its wise leadership, is working on providing all the necessary tools, means, programs, preventive and precautionary measures, plans to curb the spread of the virus, adopting the best protocols, best international protocols, and learning from the external and the international experiences to have the best for this country. And we in Dubai, we are working within an integrated system as a one team in light of also the federal regime, where we all work hand in hand in order, first of all, to curb the spread of COVID-19 and to provide the treatment and have more recoveries. Of course, we had a lot of plans and many programs that have been put in place by the Dubai Supreme Committee of Crisis and Disaster Management in coordination with the National Emergency Crisis and Disaster Management Federal Authority. We are working in one context in order to curb the spread of COVID-19. Thank you, Your Excellency, Mr. Al-Qutami. We will start taking the questions of the media people with us. We start with, of course, first Mr. Abdullah Hamid, who is the editor-in-chief of Gulf News. Of course, first of all, we would like to thank you for all your efforts. My first question, how did you deal with the labor camps? What were the measures that you have taken in order to curb the spread of the virus among the laborers? We at the Dubai Police Force, we have worked with our partners in the government, and we have worked with the laborers' committees and all stakeholders in order to work with these categories, because this category of laborers is one of the Dubai community. We were keen on protecting the safety of everyone. We put different awareness programs. Also, we have formed a point at those areas to raise the awareness of the laborers. We have delved into all the details. We even looked into the number of passengers per bus. We have made sure that all the facilities are abiding by the health measures taken, such as wearing the gloves, wearing masks, and applying the physical distancing of minimum 2 meters. And of course, we have sterilized those areas in collaboration with the Civil Defense and Dubai municipality. A lot of efforts have been also deployed by many of the volunteers from different nationalities who are also working on raising the awareness of the laborers, in addition to the charity organizations whom we thank for their contribution in providing the necessities for those laborers. Of course, we can see that we had some false information regarding the recovery period. How much does it take to really become free of symptoms of COVID-19? Some say that certain recoveries were in less than a week. Can you tell us more? Mr. Hamid Ahmad, the editor-in-chief of Gulf News, is asking you, what is the recovery period for the patients of COVID-19? Thank you, Abu Talal, for this question. The recovery period is relative. It depends on the health status of every patient, and also it depends on the immunity system of that individual. The majority of the cases, 80 to 85 of the cases, are within the range of mild cases and do not need the ICU. However, we know that the recovery period varies between 1 week up to 30 days, and this is based on to what extent the patient is being responsive. This is, of course, abiding by the international protocols and also by our local measures taken in our hospitals. Mr. Sami Ariyami, editor-in-chief of Emirates Today. Mr. Sami, your question is addressed to Lieutenant General, Commander-in-Chief of Dubai. First of all, we would like to thank you, Your Excellency Abdullah Khalifa al-Marri, and Excellency Hamid Muhammad al-Qatami, for all the efforts that you are deploying in these critical times. We extend all our thanks, and we are really grateful for all what you have been doing. Lieutenant General Abdullah Khalifa al-Marri, I would like to ask you about the measures that have been taken by Dubai Police, specifically how they were monitoring the violators using the technologies, the violators who are not abiding by the restriction of movement during the sterilization hours, where we can see that they will not be really violating these measures and impeding the putting the law in force. First of all, we would like to thank you for this question. We at the Dubai Police Force, we are working as all the government entities in Dubai, and we have strong infrastructure, as you all know, whether when it comes to the technologies used or the artificial intelligence. We at Dubai Police Force, we have tried as much as possible to use the available technologies, to invest those technologies, to use what is available of infrastructure in order to implement the monitoring of the restriction of movement that started 2 weeks back, and now it has become around the clock. Of course, we have used different channels, but I would like to summarize them. As you know, that we have used the radars that have been adjusted. They allow us to monitor who's violating the restriction of movement. We have used also the AI. The AI allowed us to communicate as Dubai Police Force with the public in the implementation of the restriction of movement. We have invested in those technologies, and we have been using them in order to implement the quarantine, the restriction of movement, and applying physical distancing. Today, the Dubai Police Force, under the umbrella of the Ministry of Interior, is working on the federal level on implementing this restriction of movement and by using all available resources to do that. We have a lot of platforms and applications. We have, for example, the e-crime platform, شرطة, and in addition now to the permits, the application where you are to apply for a permit in order to go out to buy your needs. By that, we have a unified system. Everyone will be abiding by it, and we will be able to achieve the set goal, which is the National Sterilization Program. Mr. Sami, your question now is addressed to His Excellency Hamid Al-Qatami. Abu Muhammad, you know that you have gradually started increasing the number of hours for the sterilization program. Now it is round the clock, 24 hours 7. Abu Muhammad, what is the impact of this gradual increase of the hours for the sterilization? It has become 24/7. How will it impact the number of cases of coronavirus? Thank you, Sami, for this question. We at Dubai Supreme Committee of Crisis and Disaster Management, we have coordinated with all concerned entities, and we believe that increasing gradually the number of hours of sterilization program is to be taken without having any negative repercussion on life in general in the city. And we had to take into account creating this balance between the individual's needs, the normal life, and also being able to curb the spread of coronavirus. That's why we used this gradual approach where first of all we had specific hours for sterilization, and then after that we introduced it to be 24/7. And the main goal behind this gradual increase in the number of hours for the sterilization was that to apply the physical distancing and to curb the spread of the disease. And of course, a lot of efforts have been deployed by the different entities, whether the police or the transport and the economic facilities. All were coordinating in order to be really disciplined and keeping streamless life. Those measures will leave a positive impact in curbing the spread of the disease and decreasing the number of cases, and this is by applying the physical distancing, avoiding gatherings and crowdedness. Of course, this period will be continuously assessed and measured from time to time. We will review it, reassess it to see its impact on the number of cases infected and the number of recoveries. We are working as per the experience of other countries globally who have passed through similar tough times and they were impacted by this pandemic. They have taken the necessary measures that were beneficial. We are working as per a clear integrated system. This is the first week of the National Sterilization Program 24/7 round the clock, and of course it will continue for one more week. It will then be reassessed and it might be subject to renewal every now and then. We would like to thank you for all your efforts, Your Excellency, Mr. Qatami. We move now to Mrs. Muna Bou Samra, the editor-in-chief of Al-Bayan newspaper. Your question to the Lieutenant General. First of all, allow me to thank you for this press conference, because this press conference allows us to give the right information about the current situation in the UAE. I would like also to extend our thanks to the frontline efforts for all their efforts in order to protect the safety and health of our people. I would like to address my first question to Lieutenant General Abdullah Khalifa Al-Marri, head of the Supreme Committee of Crisis and Disaster. Of course, so I would like to ask you about the Ras and Naif areas where you had increased the restriction on movement. What were the swabs taken? Will you have other swabs in other densely populated areas? It is true that Naif is one of the densely populated areas in Dubai, and of course we have taken preventive and precautionary measures in that area. Of course, we had extensive testing in it, and we made different swabs. And at the time being, we are continuing our measures since 1 week, and situation is stable. All those working in NAIF are working as based on a clear guidance of the Dubai police force, the civil defense, the volunteers. We had to do the sterilization. As you know, the sterilization was on the national level in Dubai and in different areas in Dubai. We focused on NAIF area and other areas where we had to guarantee it was free of any symptoms, and we had the different staffs working in it. As you know today, that the culture of the people in the UAE and in Dubai do differ based on the expertise. We tried as much as possible to be close to the people in those areas through the awareness campaign, through the guidance we provided, and the services provided in the area. NAIF area has a situation that's similar to any other area in any other country of the world. We are taking those preventive measures in order to curb the spread of the virus. Lieutenant General, of course, we always cannot but thank you for all the efforts, and all nationalities are praising you for those efforts on the social media. We now have Mrs. Muna, who is to ask His Excellency Hamid Mohammed Al-Qatami. Your Excellency Hamid Mohammed Al-Qatami, Director General of Dubai Health Authority, in light of this situation, the blood banks globally are suffering from the shortage in blood units due to the restriction of movement, and taking the precaution that maybe the blood donors have the virus. What is the situation in Dubai Blood Donation Center, especially that there are some patients who do need blood units and blood transfer on a daily basis, such as the thalassemia patients and even the victims of car accidents? Thank you, Muna, for this question. Globally, everyone is suffering from the impact of corona, which is disrupting the lives of people globally and affecting the blood banks, as you have said. The Dubai Blood Donation Center is considered one of the pioneer centers that adopted global and international safety standards and technologies. We at Dubai Blood Donation Center, we have been able throughout the years to have a number of volunteers reaching around 63,000 from different nationalities. I would like to highlight here that Dubai Blood Donation Center, during just 1 month, 2 months, February and March, they received 8,300 blood donors, and this is similar to the rate of blood donors on a monthly basis. Of course, we have taken all necessary precautionary measures to make sure that the blood is clean, and the Dubai Blood Donation Center provides its services for the public and the private hospitals equally. And at the same time, the Dubai Blood Donation Center is providing its services to all those who need the blood units, such as the thalassemia patients and the people injured in traffic accidents. We would like to affirm that in such a situation, the blood donation process by itself is a very noble process. It's one of the humanitarian values that is deeply rooted in our community in the UAE, and people are continuing to donate blood, and it's done based on international protocols in such circumstances where all preventive measures have been taken to guarantee the safeguarding of safety and health. We would like to thank Mrs. Muna Bousamra. We move now to Mr. Muhammad Al-Hamadi, the editor-in-chief of Al-Ru'ya Al-Iqtisadiyya newspaper. He will address his first question to Lieutenant General Commander-in-Chief of Dubai Police. My question is addressed to Abdallah Al-Marri, Lieutenant General Commander-in-Chief of Dubai Police. Thank you, first of all, for all the efforts that you are deploying in such critical times. We thank all the Dubai Dubai Police Forces. My question is related to what are your expectations? When do you expect that life will go back to normal and people will go back to normal movement as we did before the spread of COVID-19 and the COVID-19 crisis and the quarantine, of course? As you know that this is not a local or a federal situation, it's a global situation. All the world is living it. And I do believe that we had to implement these measures. And whenever we look, for example, at the number of recoveries, we can see that it has increased. We are working as per the guidance of the National Emergency Crisis and Disaster Management Authority and also the Dubai Supreme Committee of Crisis and Disaster Management under the guidance of His Excellency Sheikh Mansour bin Mohammed. We hope that the physical distancing will allow us to achieve the set goal, which is to curb and limit the number of cases and contain the spread of the disease. Of course, physical distancing or social distancing is very important at the time being. Mr. Mohammed, your question to His Excellency Hamid Al-Qatami. My question is addressed to His Excellency Hamid Al-Qatami, and of course we thank him for all the efforts. We thank the nurses, we thank the doctors and all the media personnel working in the health sector because they are the front line to combat this pandemic. My question is related to the hospitals and the bed capacity. If there is an increase in the number of patients of coronavirus and we do need more number of beds, do the hospitals have enough bed capacity? Will we need field hospitals? Are there any other alternatives that we need if we have a surge in the number of cases? In reality, Dubai Health Authority and the Dubai Supreme Committee of Crisis and Disaster Management since the beginning have been taking into consideration all scenarios, all expected scenarios in the future. And I do believe the continuous assessment that have been taken is not only done locally, but it's done globally, where you look into different scenarios regarding the number of cases infected and how you can increase the bed capacity and the hospital surgery capacity, whether the public hospitals or the medical centers and the private hospitals. Therefore, we have put clear scenarios and we have studied those scenarios. We have increased the hospital surge capacity, and we made sure that we have medical centers where we can have the isolation, we can have the quarantine, and we can have specific centers for the health quarantine. Today we have those centers, and they have been prepared and equipped with devices as per international standards and latest technologies. Of course, we have studied the probability of having field hospitals, and hopefully we will have field hospitals with the bed capacity of thousands of beds in case there is any emergency. In reality, we have studied, as I have said earlier, all scenarios, and we have put a clear plan for us to increase the hospital surgery capacity and the bed capacity for the hospitals in Dubai. And hopefully we will be working within this integrated system in partnership with the private sector and the public sector, where they will both work within one system as one health sector. And of course, we will have 2 field hospitals in the few coming days and weeks in case of emergency. Your Excellency, Mr. Al-Qatami, of course, we cannot but second what many patients have been saying. They were praising you for the role that you played and the treatment services that you have provided them with. We will also now listen to Mr. Ra'ad Barqawi, the editor-in-chief of the Gulf newspaper. Your question, Mr. Ra'ad, to Lieutenant General, Commander-in-Chief of Dubai Police. Hello everyone. Dubai has made a restriction of movement 24/7 round the clock. Of course there are violators. Can you tell us more what were the violations that you had in the last few days? As you know that we have to change our daily habits. The culture and the behavior of the individuals do affect, and in such circumstances we're talking about applying physical distancing, about wearing masks, about wearing gloves. Of course, we do have some violations, as you have all read and seen. Maybe they were not intended, they were involuntarily, but some people were reckless. They did not take any responsibility. They were so irresponsible, and Dubai police force in the last few days have posted the photos of those reckless residents on the social media because they did not appreciate the efforts deployed by the UAE government and the Dubai government in order to protect them and to contain the spread of the virus. We at Dubai police force, we would like to thank all members of the community who were committed and they adhered to the measures. They stayed at home and they complied with all the measures, but of course all the reckless residents, they will be held accountable. Of course we have a lot of compliance, or the compliance rate is very high for the sterilization program, and we had a limited number of violations. Mr. Ra'ed, what is the question to His Excellency Hamid al-Qatami? When we talk about the hospital surge capacities in Dubai, if we have a surge in the number of cases, can the hospitals in Dubai provide the services for the 4,000 or 5,000 patients? What is the hospital surge capacity for the Dubai hospitals to serve patients of coronavirus? As I've said to your colleague Muhammad, when it comes to the increase of the hospital surge capacity, we said that we have studied all scenarios, we prepared for all scenarios, and we tried to estimate the number of cases, whether 5,000 or 10,000, and even, God forbids, we have above that. We have put an integrated plan, a comprehensive plan for all the hospitals in Dubai when it comes to applying the quarantine and the isolation. Of course, when we talk about the quarantine, today what is available in the UAE you cannot find in any other country. We are providing 5-star hotels for quarantine, and we are providing this based on the best international protocols. When we talk about the quarantine in the hospitals or in the areas where we're having the quarantine, of course we have enough bed capacity that reaches the thousands. And as I have mentioned earlier, we have a field hospital that can provide the services for more than 4,000 to 5,000 patients. All this has been prepared as a precautionary measure for any emergency in the future or any changes that we have to accommodate. And this is an opportunity for me to thank many businessmen and owners of hotels and buildings who themselves volunteered to dedicate their buildings and their hospitals to be centers, medical centers for quarantine, and even can be transformed into hospitals in case there is any emergency and a surge in the number of cases. We are working 24/7 to be able to respond to any change in the spread of coronavirus. Mr. Mustafa Al-Zar'ouni, Editor-in-Chief of Khalij Times, your question to Lieutenant General Commander-in-Chief of Dubai Police. My question is to Lieutenant General Abdullah Khalifa al-Marri. Of course, we have a lot of developments, and many of the workers in the country have lost their jobs and had cut in salaries. How are you going to deal with those people? Are you going to provide them with services? Are you going to coordinate with the embassies and consulates of those who might ask to return to their countries? For example, many were in front of the embassy of Pakistan asking to go back to their countries. I heard that also Fly Dubai is offering flights to repatriate many of the expats who are here who would like to return to their homes. Before I answer your question, you know that the UAE government has been a role model when it comes to supporting its diaspora, where it had them return to their country. They used all resources and all means to have their people back, their nationals back. Of course, we are coordinating with all consulates and embassies, whether locally or on the federal level, in collaboration with the National Emergency Crisis and Disaster Management and also Authority and also the Ministry of Foreign Affairs in the repatriation of those expats. You know that there are some airports closed at different countries. Therefore, we have to coordinate with the consulates and embassies. As you said, Fly Dubai or Emirates have provided some flights, outbound flights for the repatriation of these expats, and we are always providing them with all their necessities. We cannot forget our humanitarian role. We are providing them with the social support and all the essentials. We would like to remind also of the resolutions taken by the Ministry of Human Resources and Emiratization to support the workers to also limit the economic burden on the businesses. Mr. Mustafa Azzarouni, your question to the Director General of Dubai Health Authority. Another question here I can ask, what are the measures to be taken if a person is affected by corona? The individual has to go directly to the hospital or have home quarantine and contact the ministry or the health authority. What if that individual is living with roommates in one residential unit, or he's a member of a big family living in one apartment? What are the measures? Did you provide them with the accommodation? What can they do? Were you also implementing the sterilization in the labor accommodation and in different residential units? Of course, we do have a hotline to work on this matter, and it's 24/7. If any individual feels he has any symptom of the coronavirus, he can call on the hotline, and the medical staff will directly come to that individual. They will isolate him or her from the family or the roommates, and after that we will have a monitoring and investigation with all people he or she was in contact with, and all of them, they will be also quarantined in order to make sure they did not contract the virus. After that, if there are any confirmed cases of them, they will be hospitalized. They will be sent to different hospitals or to medical centers. However, if they need health quarantine, we know that, as we said, we have specific buildings for health quarantine under the supervision of a medical team, where also the residential unit where that infected individual was will be sterilized. We have clear protocol and clear measures. Thank you, Your Excellency. Thank you, Mustafa. We move on now to a question from Al Arabiya TV, Abdallah al-Mutawwa. Abdallah al-Mutawwa, your question to the Lieutenant General Commander-in-Chief of Dubai Police. Your Excellency, Lieutenant General Abdullah Khalifa al-Marri, Commander-in-Chief of Dubai Police. There's a question that the non-nationals are asking about where they can leave the house to exercise, for example, or take their pets for a walk in certain compounds and residential areas. How do you view that? As you know, Abdullah, that all the resolutions that have been taken, and we exempted from the restriction of movement the vital sectors, and all the media and the social media have highlighted which are those vital sectors. I believe everything was clear from the beginning. Those who are exempted from the restriction of movement, whether individuals or vehicles, have been clearly defined. And of course, we have put 800 permit application for you to get a permit before you leave your house. We ask everyone to go back and read which were the vital sectors that were exempted and how they can apply for a permit. I'm not talking only about the non-nationals, the expats, but I'm talking about the nationals too. Whenever you need to leave your house, you only leave for necessity or to buy essentials and groceries, pharmacy or medicine. Therefore, I ask nationals and non-nationals, residents, everyone to go back to the media, the official media, and also to the social media to get that information. Also, Abdullah, we know that the national sterilization program applies on UAE nationals, UAE residents, and visitors. The last question, which will be addressed from you to His Excellency Hamid al-Qatami. My question to you, Your Excellency Hamid al-Qatami, regarding the coronavirus test. Is it available for all the individuals, UAE residents and nationals, or is it only limited to all those who have symptoms of flu or corona? Of course, based on the guidance of our wise leadership, we are to provide the tests for all UAE nationals and residents. And we in Dubai, we are providing this test for all UAE nationals and residents in order to protect them or to identify any suspected case if they have any symptoms, especially if they have been in contact with a patient of coronavirus. Of course, we give priority to the elderly, pregnant women, to children, and also people of determination, and those with the chronic diseases. So we in Dubai, we have provided and we have made more than 250,000 tests for coronavirus, and this is considered one of the highest rates globally provided. We have test facilities in many of our medical centers and many of our hospitals, and of course His Highness Sheikh Mohammed bin Zayed Al Nahyan, Crown Prince of Abu Dhabi and Deputy Supreme Commander-in-Chief of the Armed Forces of the UAE, has opened different facilities, and also we have one Al Khawanij. We have also the drive-through. The first one was opened in Abu Dhabi. The drive-through test, of course, all those test centers are working. We have another center at Al Nasser Club, which is also providing its services throughout the day. We have mobile tests moving from one area to the other, especially in the areas where you have where they are densely populated. This is part of the early detection approach that we have adopted through this extensive testing. We are having extensive testing 24/7, and also we are providing the tests in the residential units of the nationals and non-nationals. We cannot but thank at the end of our press conference the Lieutenant General Commander-in-Chief of Dubai Police, Abdullah Khalifa Al-Marri. Dubai, with all its institutions, has always been accurate and transparent, especially in such exceptional circumstances. We extend our thanks to His Excellency Director General of Dubai Health Authority, Hamid Mohammed Al-Qatami, for answering these questions and giving us the latest latest about the health status of the UAE health sector, the Dubai health sector, and the measures taken to contain the spread of COVID-19. And His Excellency has affirmed the strength of our medical facilities. We would like to thank all the media people for their questions, and we cannot but thank all our viewers, all the public, for being committed and protecting their families and the UAE community. Thank you.